Now, I know we talked a lot about issues that are happening in Ridgefield, but your district covers New Canaan, Ridgefield, Reading, Westport, Weston, and Wilton. What are you hearing in your travels to those areas? What are people telling you are their concerns?
Well, I think one of the major concerns that's coming out is health care, affordable health care. And the situation here in this part of the state is, I think, unique. There are a lot of people out there like me who used to work for one of the major corporations. I think you mentioned earlier that I was a vice president at Chase. And when I was working at Chase, I had a great benefits package, and you know, health care wasn't a problem for me or my family. When I decided to leave Chase, one of the decisions I had to make was, what are we going to do about health care? And there are thousands of people here in this district who used to work for large companies and who have moved out onto their own, and they're now doing web development, or they're doing marketing, or they're doing consulting, or they're doing all kinds of things, but they're doing it on their own, and they're having to find their own health care. Or they're sitting there looking, they're working for a large company, and they're worried. I met a woman in Reading a couple months ago, and we were talking about property taxes, and she was concerned about the valuation on her house and how it was unfairly valued versus her neighbor next door that had the same kind of house. And she was talking about this with the town government. She says, we really have to get this down because we might have to sell our house, and if my house taxes are higher than the person next door, then I won't be able to sell it so easily. I said, oh, are you thinking about moving? She said, no, but my husband might lose his job. He works for a large company, and nobody's safe these days. Right. Now, I don't know that woman's situation, but I do know that there are a lot of people out there who are very concerned. The economic situation in this country right now is up in the air. And if you're thinking about, what if I'm out of work for 6 months? What am I going to do? Where am I going to find the money to pay for health care? If I lose the health care, what am I going to do? Now, there was a proposal, a bill that was passed in the state legislature this past session. I think it was called the Health Care Partnership Act. And it said, let's open up the same health care system that the state employees have today and make it available to municipalities like Rudy's, to nonprofit organizations, and to small businesses, companies with fewer than 50 people, down to one person. You could be a one-person small business. And the idea was to say, okay, here's how much the state pays for this kind of coverage. If you want to pay the same amount of money that the state pays, you can join that pool. Now, why is that important? Well, I worked in financial services and banking and in insurance, and I can tell you that the more people you have in an insurance pool, the lower the costs are going to be across the pool because you're spreading the risk. It's the basic tenet of insurance, spreading the risk. So we have today about 200,000 people working for the state government or who are dependents of people who work in the state government who are covered by health care from the state, and they have a very good deal. They have a full benefit plan. It's expensive, but it's extensive. It covers everything that you would want to cover. If someone wanted to buy into that plan, that was what this health care bill was about. Unfortunately, Governor Rell vetoed it. In her veto message, she says, well, this sounds like a good idea, but we haven't thought about it enough, so I want to work with the state legislature next year to see what we can do to pass this bill to fix it. Okay. I thought it was a pretty good bill. There are 24 states today which allow the municipalities to buy into the state government plan. And there was some work done here that said that maybe we could save $1,000 per employee at the municipal level on health care. Now, Rudy, how many people work for the government in
about 175 full-time.
Count teachers as well.
Well, then you kick it up by about 400, Marty.
Yeah.
Approximately.
Wow.
So
Board of Education is the largest employer.
Yeah,
exactly.
Right.
So let's say 600, 700 people altogether are on the government payroll of some sort. So if you saved $1,000 per employee, you could save $600,000 off the tax rolls. Now, what would that have done for your property tax increase?
That would have helped a lot.
That would have helped a lot.
Okay, Mr. Hartwell, what you're proposing here is that if the governor had passed this bill or had signed off,
And signed the bill, right.
it would have saved everyone $1,000 on their health insurance.
I'm saying that
and everything would have been rosy.
I'm saying that it had that possibility. Yes, it was a voluntary system, so that the municipality, so Reading and Ridgefield, could look at this and say, do we want to do this or not? And if it makes sense economically, sign us up. And if it doesn't make sense, don't bother
Are
us.
you ultimately in favor of a state-run health insurance program?
You know, health care is such a huge issue in this country,
Yeah.
and it's, I think, going to be a central issue in the presidential race.
Yeah.
And I am a supporter of a universal health care system. I think it should be done at the federal level, not at the state level.
So you're going to have the federal government run the health care system?
The federal government does a great job with Medicare today. I think they could do a similar job with the rest of the health care system. If you think about it, through Medicare and through the veterans already who are on health care, this federal government is already running more than 25% of the health care system in this country today. And I think they do a good job. The VA administration does a great job with most of its hospitals. And Medicare, I think, has been a fabulous program for older people. We need to find a way to insure everyone. We are the only major industrial country in the world that doesn't have universal health care. And right now, there's $1,500 of health care cost in every car that GM tries to sell. And guess what? They're not competitive. So
yeah, they spend more money for healthcare costs in a car than they spend on steel.
Exactly, exactly. Does that make sense to you?
No, it doesn't make sense to me,
Okay.
but I'm a little frightened when the same people that run the DMV are all of a sudden going to take over my health insurance.
You know, when I go to the
medical
DMV, I go into the DMV gritting my teeth and I come out smiling. These guys get me in and out in a short time. I have never had a bad experience in the DMV.
Yeah.
I'm sorry. I think the DMV does pretty well.
Yeah. Well,
Could it be better? I'm sure.
I started my day in Canada. My wife's from Canada. We have family up there.
Right.
And I've had a front row seat to some of the shortcomings of government-run healthcare programs, because inevitably they get down to rationing services, and it's not very impressive.
We ration care today just based on how much money you have. If you have money, you can get great health care in this country. If you don't, you can't. And I met a woman a couple of months ago. She and her husband have a small business, and their daughter, who has grown, was included. They had 3 people. They went out. They're paying $30,000 a year for health care. That's after-tax dollars.
One family.
One family of 3 people. Now, she said, we have the best health care possible.
Yeah.
The 2 of them were in their 60s. The daughter was in the 30s. I don't know what's going to happen. I mean, he's going to go on Medicare very soon because he's going to be 65, so they'll change. But this couple, now I agree that these guys are paying a lot more than everybody else.
Yeah.
But you shouldn't have to pay.
But this universal
$30,000.
health care would be not a voluntary system. You would have to pay. If you didn't pay your health insurance premium, the government would be able to come in and garnish
Let's
your
be
wages.
very clear here, Marty. The system that I'm talking about that the governor vetoed
Yeah.
was voluntary.
Okay.
It said, if you want to buy into this system and pay the same amount of money that the state pays, plus a small administrative fee, we'll let you in. Universal health care at the federal level, who knows what it's going to look like. We'll be talking about this for the years to come.
But essentially you're in favor of it in principle.
In principle, I am in favor of universal health care, yes.
Okay.